I'm in chapter 14 of the Fundamentals book. We are going to talk about safe patient movement or safe body mechanics for assisting patients. As you know, it would be really easy to get hurt at work. We're always helping move patients up in bed, helping patients get up to the bathroom, helping them lay back down. Some of these patients need a lot of assistance. So if we don't use safe practices for moving these patients, we can get hurt very easily. So let's talk about some good ergonomic principles that you may get asked about on your ATI exam, but are also just good to know for practice too, like when you are in the hospital. So you always want to spread your feet apart to lower the center of gravity, which helps to increase your stability. So you don't want to be standing totally upright with your feet really close together. You want to kind of widen that stance and support your core. You want to distribute your weight between the major muscle groups in your arms and legs when you're lifting. So you don't want to just use all arms when lifting. You kind of want to squat and use your arms and legs when lifting something up. When lifting an object, you should hold it as close to your body as possible. So I have seen questions that have pictures. So which one of these shows good ergonomics or safe movement? And they'll show somebody with a box out to the side like this, or out in front of them with their arms extended, and then they'll show someone with that same box close to their body. You always want to choose the one that's close to the body. So that's really important to know. You should avoid twisting and bending at the waist. So you shouldn't just keep your legs straight and just bend over, and you should avoid twisting. So if you need to bend over, you should squat, bend your knees, not bend over at the waist. You should always get help when repositioning a patient, and you should use smooth movements when you are moving patients. So let's now talk specifically how to move a patient from a bed to a gurney or vice versa. So I was actually a transporter during nursing school, so this is something I did a lot, and you will get questions on this occasionally. So let's say you're moving from the gurney to the bed. You want to position the bed just slightly lower than the gurney. So wherever you're headed to should be a little lower than where you're coming from. You want to lower the head of the bed so the patient is flat. You want to have the patient tuck their chin into their chest and give themselves a hug, basically cross their arms over their chest, and then you slide them across. So if they aren't tucking their head in, then their head can get it could get damaged during the transfer. And again, if their arms aren't here, then they're at the side, they can get rolled over. It can get ugly. So again, tuck the chin, cross over, lay the head of the bed down, and make the destination just slightly lower than where you're coming from. Also, foot drop is something that can happen, especially as we get older. So I brought a bear to demonstrate here. Say this is our patient, and here's his little foot. So with foot drop, their foot just kind of drops down like this. It's almost like their toes are pointed, and we don't want this to happen. We want to keep those feet flexed. So we put in a board basically to hold that foot in this flexed position versus letting it drop like this. So again, that board will rest against the soles of the feet to keep it flexed. So that's foot drop. Let's now talk about bed positions. So there's a lot of them. So first we have semi-Fowlers, which is where the patient their head of the bed is elevated 15 to 45 degrees, most commonly 30 degrees. This helps to prevent aspiration and also helps promote ventilation. So it's easier for a patient to breathe when the head of the bed is up a little bit versus when they're flat. Then we have Fowler's position, which is a little higher even still. It's between 45 and 60 degrees. This is good for procedures such as suctioning, and also provides even better ventilation for the patient versus semi-Fowlers. And then we have high Fowlers, which is between 60 and 90 degrees. This is really good for patients who have severe dyspnea, and is also good to use during meals to prevent aspiration in patients. Then we have supine. This is where the patient is flat on their back. And then we have prone, where the patient is on their stomach, which is not a position we see most patients in. However, it's really helpful for one particular kind of patient, and that is someone who has had a lower extremity amputation. So if someone's had a lower extremity amputation, it's really important that they spend time in that prone position. And this is a good one to know for ATI and NCLEX. This will help prevent hip flexion contractures. So if they were to stay on their back with their stump like elevated on a pillow, then they can end up with these hip contractures by being in that position. But if they spend some time prone several times a day for like 30 minutes at a time, this will help to straighten out that angle there, and it will help prevent contractures. Then we have the orthopedic position. This is where a patient is sitting like on the side of their bed, and they put their arms on like their over bed table and kind of lean over. This is good for patients who have like COPD. It helps to promote lung expansion. And then we have the Sims position, which is where the patient lays on their left side with their left hip and lower extremity straight and their right hip and knee bent. So this is used for administering enemas as well as doing rectal examinations. Then we have Trendelenburg. This is where the whole bed is tilted with the head of the bed lower than the foot of the bed. So it's tilted. This is the head down here. Here's the foot. So it helps to promote venous return of blood from the extremities back to the heart. And then we have reverse Trendelenburg, which is where the whole bed is tilted with the foot of the bed lower than the head of the bed. And this helps to promote gastric emptying. So you would use this with a patient who has like GERD, and it would help prevent reflux. It would keep those gastric contents kind of moving down in the GI system. And then we have modified Trendelenburg, which is where the patient lies flat with their legs elevated above their heart. This is good for hypovolemia or hypovolemic shock. So those are the bed positions. I'm going to stop here, and we will pick it up with the next chapter in my next video. Thanks.